Good afternoon and welcome to a brand new episode of Dr. Zen. I'm Sonia Das, your host for the day. Today we have with us a consultant urologist with over 17 years of experience in general urology, andrology, surgical uro-oncology and female incontinence. He is recognized as an expert in his field of oncology, prostate and treatment of urinary tract stone and therapy. At present, he works as consultant urologist with Sama Fertilization Center. Let's welcome Dr. Adil to today's episode. Welcome, Doctor.
Hi, nice to meet you today.
Great. A career as a consultant urologist with many years of vast experience working at many acclaimed hospitals and clinics. How is Sama Fertilization Center different from other organizations?
Well, this is a good question, actually. I love to work here because of the teamwork here. They are very nice and they are working together, and it leads to help the patients more. Second, they have the good equipment and the instruments here. They're really advanced. The third thing is that we are working to improve not only the female factors, we improve the male factors also,
Right.
which now considered as 60% of the infertility, according to the guidelines, according to the published papers.
Right.
And to improve the sperm quality, we have to consider and treat each patient before we go to do the fertilization IVF or extras.
Right. What are the causes of male infertility?
This question actually it is very good, and we asked from each patient for that. And the factors or the causes, it is many factors for that. One of this, and the major one, it is the urinary tract infections, especially the prostate. This is the ejaculation or the sperms needs the prostate fluid to eat from it and swim on it.
Right.
And it's very important for the quality of the sperms. Second, increasing the temperature around the testis, which the organ that produces the sperms. And this case comes from varicocele, as dilated veins around the testis. The third cause is sometimes it's hormone imbalance.
Right.
It play a big role for that. There's another factors like genetic factors like Klinefelter syndrome or Kallman syndrome, other syndromes also it can be the cause of that. There's some abnormalities acquired or congenital like hypospady or stricture in the ejaculatory duct or urethral stricture. It can lead this to the infertility.
Say, for example, if the male is infertile and
Yes.
it's through a genetic condition, how would you help the male?
Good. It is a genetic condition. That means there's some of the genetic condition, there's some production, but that's not enough to come outside the body
Right.
during the ejaculations. That means the amount is not enough to come out even from the testis.
Right.
Here we have to stimulate the testis to increase the production to get outside through the normal canals. There are some cases we need to do some surgery, small surgery, to extract the sperms from the testis directly. There is different procedures we do, like aspiration or small biopsy, or we do also this microscopic sperm extraction, which is considered one of advanced surgery in this field.
Right. So, how is male fertility or infertility diagnosed?
Well, this is the main thing. We have to start from, as usual, from history.
Right.
During the history, we get a lot of information, like previous history, previous surgery as a child, if he had some infections, some surgeries, undescended testes, for example. Second, we do physical examination to see the external genitals. The third investigation, it should be from the beginning, the semen analysis. From the semen analysis, we get the sperm count and the quality. Even the quality, we have to divide to different ways. For example, if there's some deformities, head defects, tail defects, and the motility of the sperms. Then we transfer to the another investigation or examination like the ultrasound. We get from the ultrasound the anatomy, the size of the testis, the varicocele, dilated veins around the testis, and also we see and examine the prostate, which is play a big role in the infertility.
Right.
Then we do blood investigations, like hormones investigations, and we see how is it the imbalance in the hormones. Sometimes we go more further and investigate the genotype or genes in the body to diagnose some chromosomes.
Right. So, say for example, any of the disorders or syndrome like autism or thalassemia, do you think those kids or patients affected with this may have infertility issues with them, or no?
Directly is not, but sometimes there's some genes is connected to each others. And sometimes the treatment itself affects the quality of the sperms, but direct is not. This is the chromosomes which relate to the infertility is a little bit different from the thalassemia and the others.
Right. So now in the present, we can see an increase in the male infertility cases, as you mentioned. So do you think our lifestyle plays a role in this?
Well, it has a big role for that. Now, as you see, this is a lot of overweights, obesity.
Right,
So
right.
this affects really the hormones and makes hormone imbalance.
Right.
And this affects the sperm quality. The nutrition. If our food is not doesn't have really, or it has from inside some hormones or some materials which really affects not only the sperm, affects all the cells in our body. The lifestyle, also the exercise. There's a lot of people that avoid to do the exercise, and it's very important to increase the blood circulation in our pelvis. This is near to the organs which are producing these sperms. There's some people, they are taking some injections, some testosterone, some hormones, which really affects directly the production as well as the quality of the sperms.
Do you think stress also plays a role in it, or?
The stress is play indirect with the immune system and our hormones.
Right.
And once affected, then this one affects the hormones, and our immunity increases the infection, and the immunity affects the hormones, which decrease the improvement or production. That's mean indirect, it really affects that.
It affects.
Yes.
So, say for example, if a couple has been trying for twice with IVF, and if it's, say for example, it's a male reason, then you go through the history. And you would also suggest a lifestyle change, I believe.
Of course. From our advice as a treatment, it is not only to take the medicines for this. We have to start from the beginning, how to change the lifestyles, how to, even the foods also, we talk about the food and the advice for that. And we start, after we get all the results of the examination, investigations, we start with the medicines, which is different. Each patient has different way to treat.
And how long do you think this procedure takes from?
Actually, to improve the quality of the sperm, we need at least 4 to 6 weeks.
Okay.
But to improve the quality and production, here we advise the patient, or we inform the patient that we need at least 72 days plus 10 days to become the sperm outside. That's mean 3 months.
3 months?
Yes.
All right. Nowadays, bladder cancer is a common problem which is found mostly in drug addicts, and also they are found in people who are working in an environment which is being surrounded by dangerous chemicals. So what is the symptom to identify this?
Well, that is the bladder cancer is one of the 7th most commonly cancer in the world, and around 100,000 per year. And what's good is 70% we diagnose early stages. Symptoms which appear in the beginning, it's like a blood or blood clots in the urine, Sometimes we find some bloods in the urine during the examination of urine. Sometimes the patient doesn't see that's blood.
Right.
There is also a lot of frequency of urination. That's make one of the symptoms of the blood cancer. Sometimes the patients, they went to the toilet at night many times without passing a lot of urine, just to feeling of that. That is also one of the symptoms of the bladder cancer. And sometimes in advanced cases, the patient complain of pain or some discomfort in the pelvis area. If someone has this symptoms, actually, they first diagnosis, let's say, first diagnosis, you need only 20 minutes by doctor. Only urine analysis and ultrasound with full bladder, you can really 80% exclude if there is some tumor or not.
Oh, okay.
It is very simple.
Right.
But you have to follow the, or to advise the urologist for
I
that.
haven't heard much about the bladder cancer part.
Yeah, there's a lot of people, they don't hear about that. And this is the geographic area, it depends on geographic areas. Here it is not too much, but it is in the last years,
Right.
it becomes more because our lifestyles here come back. Our foods, if it has some drugs or some hormones, or because of some foods, it has some radiation or something playing in our immune system, which is defects on. This is, as you know, the tumor comes always from this part.
Right.
And one of the most common cause of it, of course, this is the smoking. There's a lot of people, they smoke.
Oh, okay.
Yeah,
so
smoking is
alcohol
playing-
also plays a part? Or?
Of course.
It does.
Alcohol and the smoking is the most common reason for the bladder
The
cancer.
cancer. Okay. And what are the major causes for a urethral stone?
Urethral stones as well. Before we have to speak about the causes, we have to know which types of the urethral stones. We have many types. The 70% of stones consists from calcium, which is calcium oxalate or calcium phosphate. And we have 15% from uric acid, and the others, it's infection or some other substance. That means once we know which type of stone you have, we can say that is maybe it is from the intestine disease or some vitamin deficiency like vitamin D, or some material and imbalance in the kidney inside to excretion some substance more than the others. As I said, we have to know which stone you have, and we can tell the patient which the cause of stone causes by you.
Okay.
And as I said, this is really important because it is around 37%. Many people, they have stones in their life, but they don't know exactly, or they don't feel it in the early stages. Maybe some of them, they are feeling this is when they become big.
Right.
But sometimes we feel a little bit the pain, or a little bit in the back or in the side of the abdomen, and it is the small stones pass out.
Right. So you're saying that...
The main thing, it is the main cause I consider personally. If you check low fluid, it's considered the main cause of the stone, because we need the fluid to wash our kidneys and to urinary tract. As you know, this is the stone. It is accumulation or collection of crystals in our kidney, and if we don't drink good enough, that means these crystals collected together and make a big stone.
Right. So you're saying that even the vitamin D deficiency can cause stones?
Yes. Actually, vitamin D, it is a big problem. Sometimes it is the people, they think only vitamin D, it is only sun and so and so. But sometimes it's many factors that affects the vitamin D and to increase it. Vitamin D is interfere in many enzymes, hormones in our body. Vitamin D deficiency, it makes also this accumulation of these crystals in our kidney more than usual, and it helps that is to become the stone as soon as possible. I mean, it is very fast.
Okay, so but vitamin D, I think most, I think citizens in UAE itself, most of them suffer. Even myself, even I am deficient in vitamin D.
Yeah.
So it's only through sunlight that you can get vitamin D, I believe, right? Or is it through food as well?
Also, vitamin D, there is food. It can increase the vitamin D. We can say that's the mushroom, for example. This is you can get it, and you can increase your vitamin D. The sun. There's some studies showed also sometimes there's some people even they exposed to the sun they don't have enough vitamin D. This is something genetic we cannot identify right now, but what I know that if you have low vitamin D, you have at least take supplement for that to get it to the normal level, and after that, as a maintenance, you can take it from the food or from the sun.
Right. All right, doctor. So with this, we have come to the end of the interview. And thank you so much for your time, Dr. Adil, and it was a pleasure having you with us.
You too. Thank you very much.
I hope you enjoyed.
You too. Thank you.